This year, Britain's National Health Service celebrates its 70th birthday. Formed in 1948, it was the first state health service in the world. Today, the modern NHS is almost unrecognisable from the one that was created 70 years ago. It's the world's fifth biggest employer, with a budget of £110 billion a year. But it's in urgent need of treatment.
Save our NHS!
Like many healthcare systems, the NHS is faced with a funding shortfall and critical staff shortages, meaning its future looks perilous. Lord Ara Darzi is one of the world's top surgeons and a former British health minister. He's been on the healthcare frontline for 3 decades. And he's come up with a plan for reviving the NHS.
These are my talking points. The government needs to transform the NHS from a sickness service to a health and well-being service. Most of the chronic disease is related to human behaviour.
The NHS spends almost £9 billion a year dealing with diseases related to smoking and the growing obesity epidemic. To cut costs, the government needs to tackle this public health crisis at its root.
We do this in 3 ways. 1, regulation. Banning smoking was a wonderful example of that. 2nd, taxation, introducing sugar tax or a levy on alcohol. 3rdly, behavioural interventions. How do we help people make the right choices? We need to embrace innovation, whether that is digital, which has transformed every aspect of our life. We need to do the same in health. The NHS is still running on paper and fax. We need to move from that archaic times into the new times of digital.
The NHS is the world's largest purchaser of fax machines. And in some hospitals, medical equipment is no longer fit for purpose. A recent report found that machines from the 1980s were still in use in NHS hospitals.
We need to decommission the old stuff and save money to pay for the new innovations. Robotics, new drugs, new interventions. We need to look at frugal innovations, technologies that are exceptionally cheap, but at the same time delivering as good an outcome from a patient's perspective. In the 21st century, data is the energy or the fuel of transformation. Anything you could measure, you can improve, and data is one of the ways of doing that.
1 million people use the NHS every 36 hours. But there's no centralised system where doctors can access their medical data.
Most patients seeing me expect me to have all the data from their general practice. We need to drive this integration between primary care, hospital, and back into the community. You can actually predict disease before you see the manifestation of disease by segmenting the population and identifying those at greater risk.
To do this, the NHS will have to tackle fears over personal data being shared.
Sharing data is critical from a patient's perspective, and we need to win the confidence of the public when it comes to the privacy and security aspect of data sharing.
The NHS is facing a funding gap. By 2020, it's estimated to be £20 billion short.
A lot of people out there think investing in healthcare is in a bottomless pit. I could confidently tell you, not just my work, look at the work of the Lancet Commission, the World Innovation Summit for Healthcare, the best return on investment any country could make is in health. Healthy nation means a productive nation. Healthy nation means economic growth. For every pound you spend in health, you get £2 back. Quality should be the organizing principle of any health system. It's a wonderful future if we embrace it.